The subcommittee will come to order. And the chair will recognize himself for an opening statement. In today's sluggish economy with depressed wages and millions of Americans who simply cannot find work, the federal government should be encouraging businesses to grow and expand and hire more people. We should be incentivizing good jobs that provide the opportunity for advancement and increased wages. As a result of Obamacare, however, we are doing exactly the opposite, and those who are hurt the most by the law are the most vulnerable, low-wage young Americans in the retail and service industries. Obamacare has multiple detrimental effects on American workers. It contains perverse incentives for employers to, 1, not hire new employees, 2, convert full-time employees to part-time status or only hire part-time workers, and 3, drop coverage they currently provide to employees. Additionally, the new taxes and fees created by the law make it even harder for employers to compete in our current economy. First, Obamacare requires that employers with 50 or more full-time equivalent employees provide federally approved health coverage or face a tax penalty of $2,000 for every employee beyond the 30th. If a business cannot afford to provide government-approved health insurance, making the decision to hire that 50th worker triggers the $2,000 penalty on the previous 20 employees as well. In many cases, employers have concluded that they simply cannot afford the cost of that 50th employee, effectively capping their growth and ensuring that fewer jobs exist for the millions of Americans who are unemployed or underemployed. This is not theoretical. According to the January 2013 report on economic activity published by the Federal Reserve, quote, employers in several districts cited the unknown effects of the Affordable Care Act as reasons for planned layoffs and reluctance to hire more staff, end quote. Secondly, Obamacare is causing employers to convert full-time employees to part-time status and or to hire only part-time worker employees because the law defines anyone working 30 hours a week or more as full-time, thus counting against the 50 FTE threshold. We are already seeing employers reducing hours of current employees so as not to trigger the employer mandate and resulting fine. And this trend disproportionately affects low-wage Americans in the restaurant, hotel, retail, and service industries. Last month, the Wall Street Journal reported on a phenomenon known as part-time job sharing in the fast food industry. Here, fast food chains such as McDonald's, Burger King, or Wendy's will effectively share employees. An employee will work part-time at one restaurant and then go and work part-time at another. Both employers benefit. Obamacare does not require them to provide health insurance for part-time workers, but the employee suffers. He or she now has 2 part-time jobs and yet still does not qualify for employer-sponsored insurance. The Federal Reserve report confirms this trend. The report states that in Fed District 7, Chicago, some employers, quote, are also beginning to limit hours for part-time workers to less than 30 hours in order to avoid the 30-hour, that's the full-time employee status, rule related to the Affordable Care Act, end quote. Thirdly, those Americans blessed with a full-time job may lose their employer benefits. Many large employers have concluded that paying the $2,000 fine is still cheaper than providing health coverage. In some cases, large employers have found that they could save hundreds of millions of dollars or even billions of dollars by dropping coverage and paying the fine. These devastating consequences of Obamacare are already being seen today, and as the law goes into effect in 2014, will only get worse in future years. I look forward to hearing from our witnesses today exactly what the effects of Obamacare will be on jobs and the workforce. And my time is up, so at this time I'll conclude and recognize the ranking member of the subcommittee and help Mr. Plum for 5 minutes for an opening statement.
Thank you, Chairman Pitts. Critics of the Affordable Care Act have frequently claimed that the law would have a negative impact on jobs and the overall health of the U.S. economy, but these claims have not been borne out by the facts. Simply put, health reform is contributing to lower health care costs, which benefits families and employers by helping free up capital for saving, investing, and hiring. Overall national health spending is growing at a slower rate than it has in decades. The latest job numbers released last week showed that over 6 million private sector jobs were created since we passed the Affordable Care Act, and 750,000 of those jobs are in the healthcare sector. Now, today I expect my colleagues to attempt to make the case that Congress must eliminate the employer mandate. Of course, they advocate that we should repeal the healthcare reform, and their budget, which I understand they're voting on right now, and the Budget Committee would once again repeal the Affordable Care Act. So, they're honing in on the employer mandate as just part of their overall effort to kill the Affordable Care Act. But I strongly believe that these efforts to repeal not only the employer mandate but the whole bill are misguided. Most American workers already get their insurance through their employers. In fact, almost all, 93% of businesses with 50 to 199 employees already offer coverage. The Affordable Care Act purposely didn't change that, despite claims that it's a federal takeover of health insurance. And in a private employer-based system aimed at getting as many Americans covered as possible, which is the main goal of health reform, it's important that all but the smallest businesses share the cost. And that's why every small business with fewer than 50 employees is completely exempt from the law's employer responsibility provisions. Now, it's no secret that medical care accounts for 18% of the U.S. gross domestic product, and it's taking up at least as much of the mind share of plenty of American entrepreneurs and business owners. So what the Affordable Care Act attempts to do is increase access to the millions of uninsured Americans while slowing the growth of health care. Now, I feel like we've had this discussion so many times. I don't know how, 50, 100. We'll have it again on the floor with the budget this week. Unfortunately, it's still misunderstood that the rate at which healthcare costs have risen hang on the fact that so many have gone without insurance. Those uninsured don't go uncared for if they get sick, but instead they use the emergency room or simply go to the hospital and don't pay. And these billions in uncompensated care get passed along to the healthcare consumers, including large and small employers who offer insurance in the form of higher premiums. So by covering more people, we eliminate the need to cover this uncompensated care. Now, I advocated and pushed forward the Affordable Care Act because I strongly believe that as health care costs were skyrocketing, American families and businesses simply couldn't continue to bear that weight. Business owners know that if current trends continue, health care spending will double in less than 10 years. For those American businesses and for the economy, defending the status quo just simply wasn't an option. And I know a lot of businesses are unsure, Mr. Chairman, of the law, and some are fearful that will cause an inability for the business to grow. But I believe that the mandate helps put smaller businesses on a more competitive footing with large firms, and it evens the playing field for those businesses that already provide health coverage but are forced to compete with companies that don't. So, Mr. Chairman, let me just close by saying, above all else, I believe that most employers want to be part of the solution, and once they begin to comply, I'm confident they'll begin to understand the overall advantages to offering health benefits. Republican efforts to discredit the law and misinform the public can't obscure the fact that more and more Americans are benefiting from the provisions of the Affordable Care Act. I just don't understand. We continue to have hearings about either repealing the bill outright, which is what the Republican budget is discussing, the Republicans are discussing in the Budget Committee right now, or repealing parts of it, or cutting back on the funding. The fact of the matter is the Affordable Care Act is a good bill, and the more there are efforts to cut back on funding it, not implementing it, the more Americans will suffer. So I hope this is the last hearing we have on why the Affordable Care Act is in the Republicans' opinion, not a good idea, but I guess that's wishful thinking on my part. I yield back.
That's wishful thinking. On Friday, we have one on premium increases that will further discuss the impact of the new law on premiums. With that, the chair now recognizes the chairman of the full committee, Mr. Upton, for 5 minutes for his opening statement.
Well, thank you, Mr. Chairman. You know, millions of Americans are still struggling to find jobs, and it is this committee's main priority to get them back to work. Today, we're going to examine the Affordable Care Act's impact on the economy and jobs. Unfortunately, based on testimony that we're going to hear today, it is clear that the law is hurting our nation's economy, and those Americans are trying to find work, and particularly with those Americans are trying to find work and make ends meet. Just this past week, the Federal Reserve released a report that painted a pretty grim picture of how the law is going to affect our economy. According to the Fed's own analysis, the law is leading employers to delay and minimize new hires. Uncertainty stemming from the health care law is a leading concern for American businesses large and small. One major provision causing much of the uncertainty is, of course, the law's employer mandate. Starting next year, employers with 50 or more full-time workers will be forced to provide Washington-approved health care coverage or pay a tax penalty. As we're going to hear from our expert witnesses today, this requirement is going to hurt part-time workers looking for more hours and Americans still looking for a job. As a result of the health care law, employers with 49 workers must now weigh whether hiring an additional worker is really worth the $40,000 tax penalty imposed by the IRS if they're unable to provide Washington-approved health care coverage. At a time when our unemployment rate is still much too high, the Affordable Care Act is making it harder for our nation's employers to hire new workers. The new law is, in essence, penalizing job creation. For employers who decide that they're going to still want to offer health care coverage, the law is going to make it even more expensive. Last week, our committee released a report highlighting over 30 studies that analyzed the new law's impact on health care premiums. One survey found that small group premiums could increase as much as 200% for employers with younger workforces. A specific provision causing premium increases is the $165 billion in new taxes on plans, medical devices, and drugs that are going to be passed on to consumers. In addition, the Affordable Care Act includes price controls, regulations, and mandates that are going to lead to huge premium spikes. In my home state of Michigan, some folks will see their premiums go up as much as 35 to 65%. These statistics are not just projections on a sheet of paper. They have significant consequences as millions of American workers will see lower wages and less take-home pay because of the new law. Let's hope that we can work together to see what we can do to get these things down, and I yield the balance of my time to Dr. Burgess.
And I thank the chairman for yielding. I thank the chairman of the subcommittee for calling this hearing. We've all heard, of course, that provisions of the Affordable Care Act are not going to take place until January 2014. But honestly, employers and companies are already feeling the effects of this disastrous law. The affordability, patient protection, accountability, and affordability, I can't even say it, affordability doesn't belong in the title, but it has a direct and indirect effect on employers and employees. Individuals will not only be affected directly by new taxes, but also indirectly as employers are forced to lower wages and decrease hiring in order to compensate for the new taxes that employers face. The law includes a tax intended to encourage employers to provide health insurance to their employees. Instead of encouraging growth, this tax creates a disincentive for employers to grow their workforce. Not only does the law tax employers more if they hire additional employees, but the law gives employers an outlet, a safety valve, to drop coverage for their employees by providing premium subsidies to individuals in the exchanges. At a time this country is beginning to find relief from the severe recession and its high unemployment, now is not the time to discourage economic growth. Instead of expanding coverage and lowering costs, the President's health care law has pushed greater costs onto the backs of consumers, forcing those who are not responsible to bear the effects of higher costs. And Mr. Chairman, I just can't help but observe this past weekend when I sat down with my accountant with a shoebox full of receipts to do my income taxes, he pointed out to me on the W-2 form a new line, which has not existed before, in which the employer's contribution to an employee's health insurance now appears. It begs the question, why is that there? At some point, that line is going to be taxed. Right now, it's there as sort of an innocent bystander, but trust me, the IRS will not sit still long before that's added to the tax burden, which only increases the cost of delivering care in this country. Thank the chairman for the recognition. I yield back my time.
Chair thanks the gentleman and now recognize the ranking member of the full committee, Mr. Waxman, for 5 minutes for an opening statement.
Thank you, Mr. Chairman. Today's hearing is entitled Obamacare and Jobs. It's a topic that has been the focus of an endless stream of campaign ads, press releases, and talking points ever since the passage of the Affordable Care Act in 2010. Given this topic's prominence in the Republican echo chamber and this subcommittee's hearings on it in the last Congress, it's understandable if members experience some deja vu during today's hearing. We will hear some dire predictions that we have been hearing for 3 years about this supposedly nefarious piece of legislation. And just as before, these claims will be what every independent fact checker has called them: whoppers, false, and political gamesmanship. Since the passage of the Affordable Care Act, we've added 6 million private sector jobs. That is 3 years of continuous job growth. Throughout this period of growth, businesses have known what reforms look like. They've had time to plan and to account for new rules and consumer protections. And despite the dire warnings about this job-killing law and the troubling statements some businesses have made in anonymous surveys, we have seen steady job growth and we've seen health costs rise at historically low levels. Republicans expect us to believe all of this is happening in spite of health reform rather than because of it. And that's their right to say it, but it's not credible. I hope that Republicans will heed Speaker Boehner's advice to accept health reform as the law of the land. I hope that they will start looking at the empirical evidence rather than the Tea Party rhetoric. The Democratic witness today, Dr. Linda Blumberg, has looked at the empirical evidence. She, like the Congressional Budget Office, or I should say the nonpartisan Congressional Budget Office, has crunched the numbers and determined that the Affordable Care Act does not raise costs on employers, will not cause job losses, and will not lead to a decline in employer-sponsored health coverage. But I fear that the reason we're here today is not to discuss what is really in the Affordable Care Act, or to have a good faith discussion about ways to improve upon it in the future, or to make sure that it succeeds. Rather, the goal is to amplify the voices of a small minority who believe that the discriminatory, dysfunctional system we've had before was working fine. My Republican friends think that we should double down on the same deregulatory approach to health insurance that led to ever higher costs, tens of millions more uninsured, and did nothing to control health care costs. I don't believe that's the way forward. Because of health reform, insurers will no longer be able to exclude consumers from coverage based on pre-existing conditions, or gouge them for 40% profit margins, or charge them premiums 10 times as high as their neighbors because of a pre-existing condition, their age, their gender, or for any other reason. Because of health reform, small businesses are able to get tax credits to help pay for coverage, and they'll be able to pool their purchasing power like bigger businesses to keep their costs low and decrease the risk that one sick employee will dramatically raise their costs. And because of health reform, workers will have the security of knowing that they can get a quality, affordable coverage even if they change jobs or their employer doesn't offer it. Because of health reform, businesses will have a healthier, more productive workforce. These are real steps forward. It's interesting to take note of the Republican budget that was just presented to the world yesterday. You know what they did? They took all the savings in the Affordable Care Act they complained about and kept them. But they took all the benefits of the Affordable Care Act and repealed them. That's what they would like to do to this country. I think that we ought to note that, as we have this hearing, which is just for politics, just as their budget is just for politics, but it's the same politics that was rejected by the American people in the last election. Accept the Supreme Court decision, accept the election results, work together as Americans to make sure that we can successfully cover all Americans for health insurance and not see them treated so poorly as we've had in the healthcare system over all the time up to the present. Thank you, Mr. Chairman.
Chair thanks the gentleman. We have one panel today, and I will introduce them at this time. Three witnesses: Ms. Diana Furchtgott-Roth, Senior Fellow at the Manhattan Institute; Dr. Linda Blumberg, Senior Fellow at the Urban Institute; and Mr. Tom Boucher, owner and CEO of Great New Hampshire Restaurants, Inc. He's testifying on behalf of the National Restaurant Association. You will each be given 5 minutes to summarize your testimony. Your written testimony will be entered into the record. Ms. Furchtgott-Roth, you're recognized for 5 minutes for your opening statement.
Thank you very much. Thank you very much for inviting me to testify today. As we've heard, the Affordable Care Act is going to raise the cost of employment when fully implemented. Companies with 50 or more workers will be required to offer a generous health insurance package. The penalty raises significantly the cost of employing full-time workers, especially low-skilled workers, because the penalty is a higher proportion of their compensation than for highly paid workers. So the $2,000 penalty amounts to 10.9% of average annual earnings in the food and beverage industry and 9.3% in retail trade. This is in addition to the employer's cost of Social Security and Medicare. So whereas economic models might show that the cost does not have an effect on the overall amount of hiring, it does have effects on specific parts of the employment spectrum, namely low-skilled workers. To look at the effects of the requirements to offer health insurance, I suggest to the honorable members of the committee the following thought experiment. What if employers were required to pay the costs of food, clothing, or housing for their employees? These are admittedly far more important than health insurance. Well, they would hire employees with more skills. They would reduce the cash wage to compensate. This is what we're going to see in the same scale for employees with the Affordable Care Act. So I heard today from the honorable members that the Affordable Care Act doesn't raise costs and they don't see why it raised costs. Well, here's why it does. First of all, it requires an overly generous plan. A plan offered in the exchange has to have no co-payments for routine care, mandatory drug abuse coverage, mandatory mental health coverage, and low-cost plans, catastrophic health plans, where you're just insured against where you're just insured against large expenditures, such as falling off your bicycle in traffic or catching cancer or having a heart attack. Those kinds of plans are not allowed, but those kinds of plans are less expensive than the other plan. Another reason it raises costs is the structure of guaranteed issue. Under the Supreme Court decision, you could pay a tax and legally not get health insurance. The tax is $95 the first year, 2014, about $350 the second year, $690 the third year. That's much smaller than the cost of buying health insurance. So anyone who's young and healthy is going to just legally pay the tax, not get health insurance. So the pool of sick people in the, who are insured is going to get sicker and sicker. So we're going to get many more sick people in the pool of insured. That is going to raise costs. These people who are uninsured, who pay the tax, are then going to go to emergency rooms. So people will still be going to emergency rooms. There's also a large loophole in the bill that is again going to require people to go to emergency rooms if you get affordable care under the Act. If your employer offers you affordable care, you are required to take it. So say you are married, you have a family, your employer offers you affordable health care, but he's only required to offer you affordable care for a single person, not for a family. You are required to take that. Say you have a wife and 3 children, and you are low income. The wife and 3 children cannot get subsidies on the exchanges. They're not required to be insured by the employer either. So these people, the families of individuals who are insured by their employer, are going to be going to the emergency rooms because they won't qualify for subsidies. What we have here in the bill is a bill that gives people an incentive to hire high-skilled workers, because if you hire a high-skilled worker and you pay them, say, above average wage, above $50,000 a year or so, you take the cost of their health care plan out of their wage. They get a lower cash wage. So you, as an employer, you're left basically where you are before. But low-skilled workers, you are incentivized to hire part-time, under 30 hours a week. If you're a small business, you're incentivized not to grow more than 50 workers, because then you get a penalty. You're incentivized to hire capital for labor, as we see these self-scanning machines in drugstores, and we see that people who take money when you go out of parking lots are no longer there. You just put your credit card in a machine. So the economy might do fine, as Dr. Bloomberg is going to say, but low-skilled workers are not are going to lose out, and the cost of health care in the United States are going to rise because of the incentives that I just described. Thank you very much for giving me the opportunity to testify, and I would be glad to answer any questions afterwards.
Chair thanks gentlelady, and now recognizes Dr. Blumberg for 5 minutes for opening statement. Can you press the mic button?
Oh, sorry.
Yeah.
I appreciate the opportunity to testify before you today on the impact of the Affordable Care Act on American businesses and workers. The views that I express are my own and should not be attributed to the Urban Institute or its sponsors. My testimony draws on my own and my colleagues' analyses of the ACA, much of it relying on the Urban Institute's health insurance policy simulation model, a microsimulation model that incorporates the best economic behavioral research to estimate individual and employer responses to the specific provisions of the law. Our analysis shows that if the Affordable Care Act had been implemented in 2012, employer-sponsored coverage would have increased by over 4 million people. In small, mid-sized, and large firms alike, more workers and families would have had private health insurance. The largest relative coverage increase, about 6.3%, would have occurred among workers in small firms with 100 or fewer employees. The 2.7% increase in individuals covered by employer plans in total would have cost employers the equivalent of 0.0003% of total wages. For businesses in general, employer premium spending per person insured would not be affected by the law, remaining constant at about $3,650. But for small employers, premium spending per person would decline by about 4%. For small businesses with 100 or fewer workers, our analysis shows that on average, employers choosing to offer coverage would find average cost per person insured reduced by 7.3%, and spending for the group as a whole reduced by 1.4%. The reductions reflect efficiencies in the insurance market and tax credits that offset premium costs for the smallest employers with the lowest wage workers. The law leaves the cost per person insured virtually unchanged for large businesses with more than 1,000 employees. These employers already cover the vast majority of their employees, will continue to do so, and will retain the flexibility to define their own benefits. Coverage increases, largely due to somewhat higher employee enrollment rates, would increase total spending by large businesses by about 4%. Only mid-sized businesses with 101 to 1,000 employees as a group experience an increase in cost per person insured, reflecting penalties on as many as 5% of these employers who are not currently providing coverage to their workers. Expanded enrollment, however, is the primary factor contributing to an increase in overall spending. Aggregate employer spending on health, taking into account the increase in the number of covered lives and new assessments, would increase by roughly 2%. In short, contrary to concerns that the ACA will increase costs and reduce employer-sponsored coverage, the law will have a negligible impact on total employer-sponsored coverage and costs and make small businesses, for whom coverage expands the most, financially better off. An increase in employer costs equal to a small fraction of a percent of total wages could simply not have large implications for the overall level of employment. Plus, the increase in healthcare spending under reform will expand employment in the health sectors, largely, if not completely, offsetting any small employment effects in other sectors. In addition, Lisa Dubé and colleagues, consistent with analysis by Kolstad and Kowalski, find that there is no evidence that the similar comprehensive reforms implemented in Massachusetts in 2006 had a negative effect on employment in that state. In fact, Dubé et al.'s findings hold up even when looking specifically at the most vulnerable employers, the smallest firms and those in the retail trade and accommodation and food service industries. Most employers potentially facing additional costs do have counterbalancing effects that should largely offset these. First, the best empirical economic literature finds that most, if not all, of the contributions that employers make to the cost of their health insurance are passed back to workers over time in the form of lower wages than they would have had in the absence of health benefits. This will be the case whether the employer's costs come as premium contributions or assessments paid as a consequence of not offering coverage. Most workers will value having access to employer-sponsored insurance, and evidence shows that they are willing to trade off a portion of their wages to obtain those benefits. Second, employers of low-wage workers can benefit from the expansion of Medicaid eligibility, which will provide comprehensive low or no-cost coverage to the lowest income workers, with no penalty to the employers for their participation. Third, more comprehensive information and easier price comparisons in the small group market could well lead to increased price competition, making employers and their workers more effective shoppers and pressuring plans to lower costs. Many state-based exchanges are already exploring defined contribution approaches for their small group exchanges in order to provide employees with plan choice, largely absent in small group today, while still providing employers with the ability to limit their contributions to the cost of coverage. The bottom line is, this is a very complicated set of interactions, but all of our research indicates that the total effects of the ACA on employers and employment will be quite small. Thank you very much, and I'm happy to answer any questions you might have.
Chair thanks the gentlelady and now recognizes Mr. Boucher, 5 minutes for an opening statement.
Thank you, Chairman Pitts, Ranking Member Pallone, and members of the committee. I appreciate this opportunity to testify on behalf of the National Restaurant Association. I am Tom Boucher, an independent restaurateur and owner and CEO of Great New Hampshire Restaurants, Incorporated. My business partners and I operate 8 restaurants, doing business as T-Bone's Great American Eatery, Cactus Jack's Great West Grill, and the Copper Door Restaurant. Like many people in our industry, my first job in our company was as a server. Over the years, I worked my way up in the organization as a dining room manager, a head kitchen manager, and general manager. In 1995, I became a partner, and in 2004, Chief Executive Officer. Our core business practice is to make decisions that equally benefit our guests, employee, and company. We call it our three-legged stool approach to success. A high priority is to ensure that we take care of our 503 employees to the best of our ability. As a mature company, we have many veteran and long-term employees who perpetuate our culture and core values. Over the years, it is our employee benefits, including health care, that have helped us recruit and retain the best people to contribute to our success. The food service industry is extremely diverse. Every operator will face a host of difficult decisions based on healthcare laws requirements. My partners and I have spent countless hours considering how to comply with the law, with a focus on maintaining employees' healthcare coverage. We have made changes since the law's enactment that we hope will help us better prepare for this transition. For example, we offer benefits to our salaried full-time employees and hourly employees who work 30 hours a week. Currently, of our 242 hourly full-time employees eligible to enroll in our plan today, only 45% accept our coverage. We have found it challenging to predict how many of the remaining 55% will accept our offer of coverage in light of the individual requirement that begins January 1, 2014. For instance, we can't determine how many of our young workforce will choose to pay the individual mandate tax penalty instead of accepting our offer of coverage in 2014, 15, and beyond. The future coverage take-up rate is hard to predict given many factors, but it could mean a significant increase in the costs employers may struggle to absorb when offering coverage. This is merely one example of the uncertainty and challenges resulting from the law. Our team's best estimate is that 75% of the hourly full-time employees eligible today but are not accepting our offer of coverage today will do so in 2014. Assuming plan costs were to remain the same, which they likely will not, such an increase in the employee take-up rate of our plan would increase our company's health insurance costs from $500,000 a year to $700,000 a year, representing a 40% increase. An industry that already operates on extremely low profit margins, these types of increased costs cannot be easily absorbed or paid for by merely raising menu prices. While there are numerous aspects of the law that are complex, and my colleagues in our industry will struggle to implement, another that will impact my company is the requirement that businesses with 200 or more full-time employees automatically enroll their new and current full-time workers in their lowest cost plan unless they affirmatively opt out of coverage. This requirement changes the relationship that we have with our employees, especially those that may have health care from a spouse or parent. If that employee does not opt out of coverage, I'm forced to enroll them on their 91st day of employment. This creates several problems for me. I do not like deducting premium contributions from my employees' paychecks without their authorization, especially if it leads to duplicative coverage. This reduced paycheck could create financial hardship on the employee. Moreover, it will lead to more administrative work and cost on my end as I have to remove them from the plan. Congress should eliminate this provision. There has been a lot of recent attention about the law's definition of full-time employment at 30 hours a week. The restaurant industry is not a 9-to-5, 5-day-a-week operation. We are an industry that requires flexible schedules and work weeks. By redefining full-time employment at 30 hours, employers are going to have to make a decision about how many hours their employees work, and an unintended consequence of the law could be reduced hours, especially for employees that are just above the 30-hour threshold. As you can probably tell, I've made a business decision to not reduce any of my employees' hours. However, this is something that everyone in the industry is going to be closely examining as they better understand the impact of the law on their business. The National Restaurant Association and its members are hopeful that policymakers will remain open to constructive revisions to the healthcare law that will mitigate its effects on our nation's job-creating business. We look forward to working with Congress as we address these challenges. Thank you for the opportunity to testify today on the healthcare law impact on our restaurant and food service industry and the challenging environment it will cause for job creation and growth. And I'll take questions, and thank you for the opportunity.
Chair thanks the witnesses for their opening statements, and now we'll begin questioning by the members. And I'll begin questioning, recognize myself 5 minutes for that question, for that purpose. Ms. Furchtgott-Roth, when PPACA was enacted, the then Speaker of the House, Nancy Pelosi, claimed that the health care law would create 4 million jobs and almost 400,000 jobs immediately. However, your testimony underscores that PPACA will do the exact opposite and hurt job creation. Job creators face major incentives to reduce hiring and shift employees to part-time work to reduce the damage of the law's employer tax penalty. Given your expertise and your experience as the former chief economist at the U.S. Department of Labor, does former Speaker Nancy Pelosi's claim bear any resemblance to reality?
I don't think that the Health Care Act is going to create 4 million jobs on net. It's obviously going to create jobs in insurance and hospital administration. Apparently, it's going to create many, many jobs in the IRS, because the IRS is going to have to evaluate whether individuals have paid the right taxes and penalties and how much subsidy they are entitled to, because anyone under 400% of the poverty line gets a subsidy. But it's also going to cost low-wage jobs. As Dr. Bloomberg says, with high-wage jobs, employers are just going to subtract the cost of the insurance from the wage, but this means less cash wages, so people are going to be able to, say, go out to eat at Mr. Boucher's restaurants less often. That's going to cost jobs. So it's primarily going to have a decrease in low-skilled jobs in the economy, and probably other kinds too.
Now, this claim seems particularly specious since PPACA included over 20 new taxes, which amount to over $1 trillion over 10 years. And one of the most economically damaging taxes is the 2.3% excise tax on medical devices. And studies have shown that the device taxes cost thousands of people their jobs and cost the economy billions of dollars in lost economic impact. Now, you've personally studied and co-authored a paper on this issue. Could you elaborate on your findings on this one tax alone, how it will affect jobs.
Yes, so if we are the only country putting the 2.3% excise tax on medical devices, and many medical device manufacturers export overseas. Many of them also have other plans overseas. So the incentive is when the tax is imposed here, what they would do is move production offshore to deal certainly with their offshore clients, because they wouldn't move it offshore to import in here because they would still face the tax. So I calculate that if 10% of production moved offshore, which I think is reasonable, the lost jobs would be in the range of 43,000 to 64,000. If 20% of manufacturing moved offshore, it would be a loss of 84,000 jobs to 105,000 jobs. If 30% moved offshore, there'd be a lost employment range of 125,000 to 146,000.
All right. Thank you, Mr. Boucher. Your testimony indicated that the President's health care law will add major costs to your budget. Three parts to this question. Can you explain how this cost increase affects your ability to invest capital in new investments, new restaurants, how it create new jobs? Explain how the law's regulations and uncertainty have forced you to spend more money on human resources to comply with the law, and your ability to run your business and create jobs.
Sure. You know, I've spent at a minimum 100 hours this year with my human resource person just trying to figure out the details of this law. And even most recently, we constructed a survey to send out to our staff to understand what their intentions might be based on what they know of this law right now. That was a task that took some time itself. The response level was very low because they don't understand what's happening. So we had to resurvey them individually, person by person, with our general managers actually spending time with them to do that survey. So these are all times that are not normally spent by our staff or by myself. So that in and of itself has been an enormous task. As far as the future growth of our company, you know, that added $200,000 is a real number that will not allow me to spend on capital improvements, build new restaurants, and as a matter of fact, we opted not to open another restaurant this year because we knew that this was coming and we wanted to see how it was going to play out truly before we made a commitment that we didn't have the cash to do it.
Chair, thank you, gentlemen. My time is up. Chair recognizes the ranking member 5 minutes for questioning.
Thank you, Mr. Chairman. I wanted to ask Dr. Bloomberg, obviously our Republican opponents of the Affordable Care Act make these claims that the law kills jobs. They argue that requiring employers to offer health insurance and to improve employee benefits will increase the cost of labor, and I know this is simply not true. In fact, the ACA is helping to create millions of jobs. Since the President signed the bill into law, the U.S. has added 6 million private sector jobs. This includes 750,000 jobs in the healthcare industry, which so many opponents of the law would be crushed. You know, they say it's going to be crushed with job-killing regulations. The restaurant industry, which we hear from today, has added more than 800,000 jobs in that same time period. And independent fact-checkers have examined the claim that the ACA kills jobs and call it false and a whopper, and have rated it with 3 Pinocchios. So, Dr. Bloomberg, can you explain whether the ACA is a job killer, and can you give us some perspective on the other factors that we should consider when looking at the law's impact on job growth?
Sure. The empirical evidence is quite consistent that the Affordable Care Act is not a job killer, that what we have looked at over time repeatedly with doing comprehensive health care reform, all of the macroeconomic models indicate that when you invest additional funds in health care, that some dollars are shifted from other products into the consumption of health care. But because health care is by its nature a locally produced good, and when others are buying things that are coming from other countries, that what happens is that some of that money that shifted to health care from other sectors actually can create a positive impact on jobs locally as a consequence of how healthcare is by its nature purchased. So while healthcare reform is not expected to have enormous positive job impacts, it's expected to have small net positive impacts. And in fact, when you look at the impacts on small employers who are most disadvantaged by the healthcare system today, there's very significant positive implications for them in terms of cost reductions and assistance in their ability to be competitive in purchasing labor with larger firms. So all of this on net, in addition to the fact that the change in costs in total to employers is very small, as I noted earlier, relative to total compensation. We can't have big effects when the change in compensation is that tiny.
All right, now let me talk. Prior to the ACA, only half of the states had the legal authority to reject a proposed insurance premium increase that was deemed excessive or unwarranted. But the ACA provides states with $250 million in health insurance premium review grants over 5 years to help states improve their rate review process and hold insurers responsible. The ACA also establishes a new medical loss ratio requirement, which requires insurers to spend 80 to 85% of premium dollars on benefits. And consumers have already received over $1 billion in rebates from insurance companies that failed to meet this important new standard. Together, these provisions have already saved consumers over $2 billion, and the number of double-digit premium increases has fallen dramatically. In March 2012, CBO projected that premiums are estimated to be 8% lower by 2021 than originally estimated, and this is an especially important finding because of all the ACA does to make sure consumers have, overall more valuable quality insurance. So, Doctor, just talk a little bit about how policies like rate review and limiting excessive insurance company administrative costs benefit businesses and consumers.
The medical loss ratio changes that you talked about, moving to across the board minimums of 80% in the small group and the non-group markets in particular, are very significant changes. The medical loss ratios in large group coverage were already reasonably high, so the law doesn't have nearly as much impact on them. But we have looked very carefully at medical loss ratios prior to the implementation and reform by state and found that, first of all, there's dramatic variation across states, with some states having the vast majority of enrollment in the small group and non-group market in plans that had lower medical loss ratios than the law required. And so the impact on them is going to be very substantial in terms of lowering premiums. Those carriers are going to have to restructure and are already in the process of restructuring their cost structure in order to be more efficient in terms of their administrative costs and the way that they market their plans. And in addition, the exchanges will help with that in terms of doing more centralized marketing for coverage and lowering those costs. In addition, we have had a great deal of experience going to a number of states to talk to them about their experiences in implementing the Affordable Care Act so far. And one thing stands out on this topic that conversations we had with state regulators, insurance regulators across the country, who noted to us that what was amazing was as soon as the medical loss ratio or the medical loss ratios and the rate review rules came in, and the rate review rule indicates that there has to be clear evidence of a reason for increasing rates more than 10%. Otherwise, they're prohibited. And what these regulators told us, as soon as the law went into effect, suddenly all the carriers were clustering. Instead of having much higher increases that they were requesting, they were all requesting them at 9.9%. And so this was evidence from the regulators' perspective that the law was already having a significant effect, even in the early years of implementation.
Thank you.
Chair, thanks, gentlemen. Now recognize the ranking member, Dr. Burgess, 5 minutes for questions.
Thank you, Mr. Chairman. Mr. Boucher, I'm so glad you're here on this panel. I know it must be tough for you. I know that because every Friday night I go to my pizza restaurant, a Domino's on Southwest Parkway in Louisville, Texas, and I get an earful from the owner who, just like you, doesn't understand how in the world they're going to comply with all of the things that are coming their way and coming pretty fast. Staff printed off for me the 21-page application that an employee will have to fill out in order to go into the exchange. I mean, it's no wonder that when you polled your employees about what they think about this, they take one look at something like this and say, I'm going fishing. I'm not gonna think about it right now. But let me ask you, you heard Dr. Blumberg's responses to some questions. Let me just ask you, do you think the Affordable Care Act is a job killer?
It absolutely can be. Because
has been in your case, hasn't it?
Well, in this particular year, it was, because we didn't actively pursue opening a restaurant. We did open one in 2011. However, that was before the elections, and quite honestly, we waited to see what was going to happen with the elections for this year. So in this case, we opted not to.
Yeah, you're not alone in that election stuff. Does the Affordable Care Act reduce your insurance costs?
Well, as it stands right now, it's going to increase it because of the amount of people that are going to come on our plan. It's not going to reduce the existing plan because every year our insurance rates have gone up. What's going to happen next year? I can only assume they're going to go up based on historical data, but certainly from what I testified earlier, that the projected amount, and this is a real number, and we did surveys individually, that 75% of our uninsured right now will come on our plan. It's going to increase. It's going to increase our health insurance costs. $200,000 is a big number for us. So try and find a way how we're going to pay for that.
Let me ask you this. I mean, you're a representative of the Restaurant Association, is that correct?
Yes, I'm on the board.
Do you have any experience dealing with cost and coverage for the state of Massachusetts after the implementation of their health reform?
You know, I don't. I just, even though we're states right next door to each other, I just don't have enough information about what exactly their plan is.
Fair enough. We might work on trying to find that out. Ms. Furchtgott-Roth, let me ask you a question. You talked about the really, I think what I would refer to as entry-level jobs, people who are just starting in the workforce.
Right.
They might find those jobs to be diminished as a result of the Affordable Care Act. Is that not correct? Did I infer correctly from your testimony?
They will find that, and they are already finding that. We hear that 6 million jobs have been created since the Affordable Health Care Act was passed. It's about 4% of total payroll jobs. Our unemployment rate is 7.7%. Our labor force participation rate is at 63.5, which is the same as September 1981, at the beginning of the decade when millions of women moved into the market before the Reagan Revolution. Our employment is shrinking. In normal recoveries, as economic growth expands, then employment also expands. Labor force participation rate goes up. Our labor force participation rates have been going down and shrinking. Unemployment rates for teens are about 25%. Unemployment rates for African American teens are 43%. Unemployment rates for low-skilled workers are about 11 or 12%. These are the people who are hurt by putting a mandate on employers. The other people, as Dr. Bloomberg says, they take it out of their wage. Okay, well, there's also effects to having less cash wages. If people are paying more for their health insurance, they have less cash wages to spend, and they can't go to Mr. Boucher's restaurant.
Have you had a chance to look at this application for employees to apply for health insurance in the exchanges?
I have not, but even a 2 or 3 page application would be daunting to me. I can't imagine what a 20-page application would be.
Correct, to someone who's just starting in the workforce who has had no experience with this type of thing in the past. You know, I think someone brought up about constructive revisions to the Affordable Care Act. Do you have any thoughts on constructive revisions? I mean, in other words, we're sitting here now less than, 6 months away, or 6 months away now from the implementation, where people are supposed to be able to go online live and register for health insurance in the exchange starting October 1st. Do you have a sense that this can all be accomplished in that time, or should we be looking at something that would perhaps postpone by a little bit this exchange activity?
I think we should definitely postpone it. HHS is behind in issuing regulations and helping set up exchanges. I would say that there are a number of things you could do. First of all, allow any plan to be listed on the exchange. Right now, only a qualified benefit plan can be listed on the exchange. Those are very large, generous, expensive plans, no co-payments, all these different mandates like mental health coverage, drug abuse coverage, contraceptive coverage, etc. Why not allow catastrophic health plans to be listed for everybody? Right now, it's just for 30 and under. What if everybody could buy a catastrophic health plan? I mean, that would make health insurance much less expensive right then. And then also the grandfathering provisions for employers. Mr. Pallone said that employers will continue to offer their coverage and that they continue offering coverage. Well, it's grandfathered only under certain circumstances. If you make any little change in the plan, it's not grandfathered anymore. So why not extend grandfathering and just say employers can continue to offer whatever plans they want? And third, I don't think that employers should have to pay for employees' health coverage, just as they don't have to pay for their food, they don't have to pay for their housing, they don't have to pay for their clothing. If we want to do this, let's have a more general tax on everyone so we don't disadvantage hiring.
Very good. Thank you, Mr. Chairman.
Chair, thanks, gentlemen. Now recognize the Ranking Member Emeritus, Mr. Dingell, for 5 minutes for questions.
Thank you for your courtesy, and I commend you for the hearing. It's my hope this hearing will be successful in establishing ways to improve and see to it that the Obamacare legislation becomes an effective support for our society and for employment. I want to commend our panel for being with us today, and I want to observe that it is a very important action for this Congress to recognize that the people have spoken, the Congress has voted, the decision of the Supreme Court and the voice of the voters in the last campaign have all been heard in support of the legislation we discussed today. My questions are to Dr. Bloomberg, and they will require only a yes or no answer. Doctor, the intent of the Affordable Care Act is improving the quality of health care delivered in our health care system, as well as expanding the access to affordable health coverage for individuals and small business. This is done in part by offering subsidies for individuals to purchase health coverage and tax credits to small employers who opt to provide such coverage. In 2014 and 2015, small employers with 50 or fewer employers will be eligible for the tax credits. And after 2015, those with 100 or fewer employees will be eligible for the tax credit. Is this correct? Yes or no?
Not quite.
Now, next question. IRS has notified more than 4 million businesses that they will be eligible for this tax credit. Is that correct?
I believe that is correct, yes.
Now, Doctor, would you agree that these tax credits make it more affordable for small business to offer health coverage to their employees? Yes or no?
Yes.
Is that a consensus?
It is.
Now, Doctor, some of this hearing today will be directed at proving that ACA will increase costs and result in lost coverage for employees. But you have found differently in your research. In your coverage simulation, which included penalties and tax credits in ACA, you found that employer-sponsored coverage did increase, and the largest coverage increase occurred among employees from businesses with 100 or fewer employees. Is this correct?
Yes, it is.
Doctor, with the increase in employer-sponsored coverage, 2%, what was the cost in terms of wages to employers? Can you give me some comment on that? I believe the answer is that this is going to only constitute about 0.003% of total wages. Is that correct?
It was 0.0003%, sir.
Now, this seems to be a relatively small cost to an employer. Would you agree?
Yes, I would.
Do you think that such relative small costs would have significant or negative impact on employment?
No.
A pollster, I think, would find this to be within the margin of error. Is that right?
Yes, it would.
And most scientific or financial research would also find this to be within the margin of error. Am I correct?
I agree.
Now, if then millions of small businesses will be receiving tax credits to help them purchase affordable coverage, and the cost of an increase in employer-sponsored coverage is relatively small, do you believe that small businesses will be financially better off under the Affordable Care Act? Yes or
Yes.
no? They don't have a nod button. You got to say yes or no.
Yes.
Dr. Bloomberg, I thank you for your assistance to the committee. Mr. Chairman, I just want to make this observation. The Congress has fallen to a place that I think all of us find to be very distressing. We are known for gridlock, for inaction, and for ineffectiveness. And the public is generally has an attitude towards the Congress that's somewhere below bill collectors and just slightly above child molesters. I think that working together to resolve the questions that we have, to solve the budget concerns, to make Affordable Care Act is a laudable goal. I know my colleagues want to do it. I hope that this hearing will have as its purpose the idea that we are going to do that, and that we're going to work together on this committee to see to it that we don't just have carping and criticism, but in fact that we do have steps taken by this committee that will make this a program which will be good for this country. We're the only nation in the world which doesn't have a program, the only major industrialized nation which doesn't have a program of this kind. So I look forward to working with you in a spirit of remarkable goodwill to accomplish that purpose. Thank you.
Chair thanks the gentleman and now recognize the gentleman from Texas, Mr. Hall, 5 minutes for questions.
Well, thank you, Mr. Chairman. Mr. Boucher, you told us of your growth and the steps you took to reach, I guess, the top or reach where you are, and I admire you for that. And understand your hesitation to gamble on an additional facility after the election. I think I know what you were saying there, and I agree with you on that. And the chair covered some of the complexity of the act on your business now, but I want to ask you about your business as you started it, and go back in the restaurant business and lay out some strategic goals for the success and growth that you had then. How do you think this obstacle would have affected your business when you were getting started, as opposed to now that you are well established, or now that we're in what the chair called a sluggish economy?
Yeah, I mean, we likely would not be where we are today. Being where I've been in this position as the CEO since 2004, it's become more and more difficult to operate business because of legislation such as this, that it's creating hardship that we hadn't seen in the past. And I know for a fact that we would not have opened the number of restaurants that we've opened had this been in place, say, 6 years ago.
And do you think that the law's definition of full-time employee comports with how most businesses operate today?
Well, no. And
prior to the Health Care Act, there was, I think, 30 hours was a typical cutoff point for the part-time employees versus full-time employees.
Yeah,
right.
I think it's the definition of full-time is not really clear, because the definition of full-time, when you calculate overtime, is 40 hours a week. So the definition of 30 hours a week really doesn't make a lot of sense when you compare it to that type of thought process. Different restaurants will categorize it differently, and I think I'm an exception where I categorize it. But just like the restaurant industry, it's a very diverse industry, and business owners in this industry will categorize it differently.
Ms. Fergoth Roth and Dr. Blumberg, do you have a different opinion of the answers that Mr. Boucher gave us? Or any comment you want to make on it? I have about 2 minutes left.
I think it's important to look at the difference between the cost of healthcare as an average cost of the average wage, as a fraction of the average wage, which is very well a small fraction of the average wage, and the cost of a health policy to an employer as a percent of a particular wage. So the fraction of a percent, it's a fraction of a percent overall, but it's 9 to 11% of the wage in low-cost occupations such as retail and food. And so whereas to an average employee, it might not make so much difference, it's very important to low-skilled workers. It's very important that they be able to get their foot on the first rung of the career ladder. Health insurance policies are going to be very expensive. In March 2012, CBO estimated that for a family of 4, a health insurance policy was going to cost $20,000 a year in 2016.
I do have a different perspective. The situation that we need to keep in mind is comparing to where we are today. And one of the things that's been clear to large employers for a long time is that health care costs of their employees have absorbed the costs associated with covering dependents who were employed by medium-sized and smaller firms for many years. And so the situation here when the employer requirements become more consistent across employer sizes over 50 is that it basically levels the playing field across employers. The other thing to keep in mind is that there are demonstrated savings from our analysis for small employers, and there are about twice as many workers in the labor force work for small employers than do for the medium-sized firms. And so there are some distributional issues that occur when playing fields are leveled and individuals and firms that have been disadvantaged in the past are put on more equal footing with their other counterparts. But overall, it should have positive implications for the economy.
And I thank you, and I yield back.
Chair thanks the gentleman, and now recognize the gentleman from North Carolina, Mr. Butterfield. 5 minutes for questions.
Thank you very much, Mr. Chairman, and thank the witnesses for their testimony today. You know, Mr. Chairman, when I received the notice of this subcommittee hearing a few days ago, I saw that the title of the hearing was Obamacare's Impact on Jobs. And quite frankly, I thought we were going to be talking about a positive impact on jobs because the evidence seems to me to be indisputable. There have been 6 million private sector jobs added since the signing of the Affordable Care Act. 750,000 of those jobs have been right in the healthcare sector, and 800,000 of those jobs have been in the restaurant industry. And so quite frankly, I thought we were going to be talking about the positive impact on jobs. I'm just having difficulty, Mr. Chairman, understanding how one can, with a straight face, suggest that the Affordable Care Act is in fact killing jobs. That is absolutely not the case. It just seems to me that having a healthy and happy workforce must be a net positive for businesses. And so I want to continue this conversation and learn more, but I don't see how the Affordable Care Act is killing jobs. In my estimation, we are creating jobs. Let me direct my attention to Ms. Roth. Thank you for your testimony. A few minutes ago, Dr. Bloomberg, when she began her testimony, and I wrote it down, she said that her words should not be attributed to the Urban Institute. Is that what you said, Dr. Bloomberg? Those were your individual words.
Yes.
So let me ask you, Ms. Roth, should your words be attributed to the Urban Institute, or are these your words?
I work for the Manhattan Institute.
I'm sorry, the Manhattan Institute.
And, these are my
yes.
words.
So we should not attribute these words at all to the Manhattan Institute.
Right. All the individual scholars speak on their own behalf. The Manhattan Institute hasn't even seen my testimony.
But you're on the payroll of the Manhattan Institute.
That is correct.
All right. I'm interested to know where the funding for the Manhattan Institute comes from. Can you tell us the source of your funding?
I have no idea of the source of my funding.
You don't know how the Manhattan Institute is funded?
No. I mean, I don't have to go out and get grants. They pay me a salary. I don't have anything to do with fundraising.
What is the budget of the Manhattan Institute? Do you know that?
I do not have that number, but I can get back to you. I'm sorry, sir.
All right. Do you know if by any chance any political organizations or any political operatives contribute to the Manhattan Institute?
I don't know the answer to that question.
All right. Let me now direct the next question to Dr. Boucher. Thank you so much for your testimony. I'm a little confused, Mr. Boucher. You mentioned in one part of your testimony that that this could really increase your company expenses by $500,000 to $700,000 if you were to add hourly employees.
No, it would increase it from 500 to 700,000.
So I was going to try to ask about the 200,000. I see what you're saying.
Correct.
So it will increase from 500,000 to
Right.
700,000. Now this is not the Restaurant Association. This is your company.
That's right.
And your company, I believe, is the Great New Hampshire Restaurants Incorporated.
Right.
What percentage? I heard the .0003 figure a moment ago. What percentage of your gross sales would that represent?
I believe it was on not gross sales.
But if you had to expend an extra $200,000 to provide coverage to your hourly employees, you're saying that would?
I would have to do the calculation in my head.
But it would be less than 1/10 of 1%, I suppose.
No.
Yeah. Give me what are your gross sales?
We're doing somewhere around 28 million. So if you do the math.
And of course that's gross sales. I mean you have a lot of overhead, and so we figure maybe a 15% bottom line, and so
how much?
Maybe a 15% bottom line. It's not that high. You wish. you wish it was.
You're not even close, sir.
All right. But notwithstanding a $200,000 increase in contribution to help your employees would not be a significant amount of money in comparison to your overall operation.
Sir, our bottom line is 9%.
All right.
Then we still have to pay taxes. Then we still have to do our capital improvements, which is depreciation, and then we have to pay our business loans. At the end of that, I'm left with about 4 cents of every dollar that I take in. So that 200,000 represents another penny off that 4 cents.
Now, in your company,
that is significant.
You have hourly employees, and then you have the higher executive employees within the company. Do you now provide insurance to any of your hourly employees?
Yes.
All right, but not all of them.
We offer it to every single hourly employee, and as I testified, about 55% choose not to take the coverage.
So that would be 30 hours or more.
Correct.
All right, Mr. Chairman, I'm out of time. Thank you. I yield back.
Chair thanks the gentleman, and now recognize the gentleman from Illinois, Mr. Shimkus, 5 minutes for questions.
Thank you, Mr. Chairman. I think my colleague who just spoke, it brings to the point, and we had it in my subcommittee, when we invite people to testify, we shouldn't impugn their comments based upon who they're employed by. And I only say this because this was raised in my subcommittee. We want to thank you all for being here and appreciate your testimony. Having said that, you work for the Manhattan Institute, and Dr. Blumberg, you work for the Urban Institute. So you're not employers. In fact, you get a check, you sign the back of the check, correct?
Right.
You get a check for your work.
Correct.
So there's only one employer here on our panel, and that's you, Mr. Boucher. Is that correct?
Yes.
So you sign the front of the check.
That is correct.
So you are the expert on how rules, regulations, and taxes affect your business, and the people you would like to hire, and the people you hire, are the people you'd like to keep underemployed. And is that correct?
Yes.
So you're the expert.
I'm the expert in my business for sure.
Thank you. And I guess the other thing that kind of rankled me was this debate about gross and net. That's a big difference. And in this bill, the medical device tax is a tax on gross, not counting the net, not taking out the expenses of producing a good. It's a gross tax across the board. Is that correct?
Right. Yes, that is correct. That's the definition of an
and that's why it's so damaging for our jobs.
Right.
Is that correct?
That's right, yes.
No one else has a tax in this sector in the world on gross.
No other country has singled out the medical device industry for a special tax, correct.
And Dr. Blumberg, don't you think a gross tax on a good that only this country has that other countries may produce might be a disincentive in the competitive market?
I would say that there's already a disconnect in the medical industries in terms of what is being
Well, let's
charged
stay on
in
the
United
point
States
on the
versus other
gross.
countries.
Let's stay on the point of the gross versus the net
But
tax increase. Does that not raise the cost of a good?
well, the costs are already higher in the U.S. because the firms charge us more.
Will the
than
gross calculation raise the cost of a good versus a competitor, everything else being equal?
True.
Of course it would. So, Ms. Furgot-Ruth, you mentioned job possible losses in the medical device industry, did you not?
Yes.
In your testimony, and they are, and they could, and they already are going to be large. Is that correct?
Right.
So that's why part of this hearing is important. And if we want to fix parts of the bill, the medical device tax would be one way that we could fix it to create jobs.
I would definitely recommend repealing that tax. Yes, absolutely.
Thank you.
And I also question the fact that you all seem to think that the labor market is healthy and 6 million jobs are being created. Well, the unemployment rate is still 7.7%. Including discouraged workers, it's 14.3%. The youth unemployment rate is 13%. And these are people who have student loans and they can't get jobs. The teen unemployment rate is 25%. This is not a healthy labor market.
Yeah, and I mean,
so
that brings...
saying that 6 million jobs are being created as though that proves that our labor market is healthy. Well, we might have created many, many more without the Affordable Care Act, and our unemployment rate might be lower.
And that's part of the debate about even youth employment, entry-level jobs, where can they get part-time employment, the bus tables, or we even have a debate about raising the minimum wage. Isn't that a disincentive, Mr. Boucher, on hiring high school kids?
What particularly?
Either or. You could talk about increasing the minimum wage.
Yeah.
You could talk about these rules and regulations, these forms in respect to job creation.
Any regulation that mandates that I operate my business in a particular manner without me having the choice to do what I think is best for my business is damaging, because I'm not going to be able to give wage increases to, say, cooks because I have to give it somewhere else, and that's because of a mandate. So
and I'll end on this. My time's up, but I do think that there is, as we raise the cost of employment through health care coverage, there is a result, and I think, Dr. Blumberg, in your opening statement, you said there could be a reduction or a slower increase in that wage for that individual consumer. So there are effects, and we just need to have this debate, and I appreciate you all being here. Yield back my time.
Gentlemen. And now recognize the gentleman from Texas, Mr. Green. 5 minutes for questions.
Thank you, Mr. Chairman. One of the key design features of the Affordable Care Act is the way it builds on our existing health insurance system to fill in gaps and make improvements rather than making more radical and disruptive change. This is especially true in the employer-based insurance market. Both prior to and after the Affordable Care Act, the majority of the Americans receive health care through their employers. But we also know in the last 3 decades, the percentage of employers covering their employees for lots of reasons has gone down. But the Affordable Care Act builds on it. People are going to be protected from the worst insurance abuses. They'll have access to quality insurance through fair individual marketplace, and if they change jobs or do not want their employer coverage. But the overall employer-based system is still going to be strong. There have been a host of scare tactics used suggesting employers will fire thousands of workers or drop coverage en masse in response to health reform. And I know particularly the restaurant industry, minimum wage is a big issue and over the years. So, and I know every time we increase minimum wage, there's concern about losing employees or that you can't afford it. Similar with health care. 2 of the most heavily cited examples are the Westgate Resorts and Darden Restaurant Group, which completely reversed their course. Darden employed thousands of people across the country, and it indicated they were planning to limit employee hours to avoid providing health coverage. but Darden reversed course and said it would not limit the hours or drop coverage following an outcry from both its employees and its customers. The same with Westgate Resorts. The CEO warned his employees of mass layoff if President Obama won re-election. Instead, he gave them a 5% pay increase. I have talked with restaurant owners in my area in Houston, and one of them, who's a longtime friend, actually a Republican, told me he costed it out, and he owns a number of restaurant locations, so he's pretty large. And he said it's not what he was concerned about. In fact, he said it's going to give him some options to offer to his employees. In fact, Mr. Chairman, let me say that we've heard a lot today from supposed birds of health reform on businesses. And I want to talk for a moment about the benefits and new opportunities in healthcare provides small business. Mike Bray is the owner of a Hobby Works, a hobby and toy store he owned for more than 20 years. Mike has always offered health insurance to employees because it's a great way to attract and retain good employees. But before the Affordable Care Act, Mike's health premiums had tripled. In my experience in the private sector, small business, 13 employees, every year we had to negotiate our rates because we had signed a 3-year contract, and they would raise our rates after the first year and second year, thinking we wouldn't go out, but we negotiated every year. Before the Affordable Care Act, his premiums tripled. He began to see his employees putting off necessary preventative care for themselves and children. In 2014, when Mike and his employees will have more choices of quality health insurance and competition and cost containment, and health reform will begin to drive down costs. Mike says because of the ACA, he finally has hope, and I quote, "Spiraling, escalating cost and depreciating quality of coverage might end." And I'd like to submit, Mr. Chairman, ask unanimous consent to submit Mr. Bray's full statement for the record from the Small Business Majority. Dr. Bloomberg, you've gone in depth of empirical research on employer health insurance and labor market. Do you think the threats of frightening projections are justified, or do you think most employers around the country should continue to offer coverage and support to their workforce just as Darden, Westgate, and Mr. Bray did at Hobby Works?
We do not expect there to be a significant change in the rate of offer, although we expect to see an increase among small employers in offering as a consequence of the exchanges. And the truth is that there is a great deal of misinformation out there, and when you talk to employers and give them the facts about the Affordable Care Act, they're often relieved relative to what they've heard. But ultimately, employers, as we've seen in many different circumstances, ultimately have to respond to market forces, trying to attract labor and stay competitive with others who are hiring. And that's really what drives their decisions, not the fear and the anxiety that comes before something's actually in place.
I have one of the highest districts in the country of people who work that don't get insurance through their employers. Before the act, employers are dropping coverage, and I have an example of that. But after the act, if employers make that decision to drop coverage, won't workers have better options in the individual market than they had before the reform?
That's absolutely true. The non-group market is highly dysfunctional in virtually every state except one in the country, and the improvements in the non-group operation of the non-group market for consumers will be a big boon for those without offers.
Well, even in Texas, even though our state won't have a state exchange, the law requires HHS to set up an exchange for those employers who decide to drop it. Their employees will have that option, whereas before the Affordable Care Act, they didn't have anything.
That is correct.
Chair thanks the gentleman. Now recognizes the gentleman from Louisiana, Dr. Cassidy, 5 minutes for questions.
Hey, thank you. Dr. Bloomberg, I got to tell you, when I speak to small employers, I mean, it's just so interesting because you walk in, they're not making a big deal about it. They just say, we're going to stay at 49 employees. And they don't make a big deal about it. You just say, well, why? And then now that you ask, they say, oh, because once we get to 50, we're hit with the penalty. If you will, if we have 49 employees, and whatever we do for insurance, we do, but once we go to 50, we have to pay $40,000 in penalties for that 50th employee, so that person's worth has to be their salary plus $40,000. And I'm struck that you don't think this will have a negative impact upon small businesses hiring.
Well, I'll explain why. Number one, it shouldn't be a $40,000 penalty because they pay the only time an employer pays a penalty at all is if at least one of their workers goes into the non-group exchange and qualifies for a subsidy. because of not having affordable coverage.
But
so
at
it's
that
not, first
point-
of all, it's not automatic that any.
But at that point, if they do, then they get credit for 30 employees, and it's the 20 that are left that they're paying $2K per person penalty, correct?
That's correct if that's the way that.
But that wouldn't inhibit somebody from going to 49, because they tell me it does.
Right. Oh, well,
so are they irrational or?
I'm happy to respond. I think that you are correct that if an employer is looking to move from 49 to only 50 employees in the long term, that they are unlikely to make the decision to add that next worker unless the value that that worker brings to the firm is going to compensate for any additional costs.
So that would be their salary plus
let
40K.
me finish, please. However, that is not the way that employers generally make decisions about hiring. When they're growing because they see a long-term expansion in profit.
I know you're
that would
saying that,
swamp
but
these
can I go on because I have
additional
limited
costs.
time?
So
And I'll
that
tell you,
if
the
they're
employers I talk to, they're actually factoring it in. Secondly, I'm struck when I speak to employers, they are decreasing the number of employees who are at full-time down to part-time. I'm struck that Mr. Butterfield says we've created more jobs. According to the Bureau of Labor Statistics, we've created a lot of part-time jobs, but we actually have 200,000 fewer full-time. There's, I think, 212,000 fewer full-time jobs in the last statistics, and there's 372,000 more part-time jobs, which to me is consistent with what I'm reading and hearing, that people are converting full-time employees to 30 hours or less. Now, I grant you we have more employment, but it's more employment with fewer benefits. How would you respond to that?
Well, in any recovery, there is going to be an expansion of part-time jobs, and I haven't seen the specifics on how many of these jobs are full-time versus part-time, but you would expect there to be an increase in both part-time and full-time.
But there's actually a decrease in full-time. There's decreased by 212,000 in full-time jobs in the last Bureau of Labor Statistics, labor whatever.
From the prior period?
From the prior period.
First of all, the full reforms that would, if anything, was going to have an impact on part-time status, those reforms are not in place at the present time. And the complexity of the economy and the dynamics that have been going on with regard to the recession and the recovery from the recession are so large and complex compared to the costs associated with the Affordable Care Act that it would be impossible to attribute.
So even though
those
Mr.
changes.
Green gave some high-profile cases of people converting to part-time, they were embarrassed, whatever, intimidated not to do so, but we know that's the tip of the iceberg, and far more have actually gone ahead and done so. We're not going to attribute it to what we're being told is the attribution, but rather we're to assume that the answers are too complex for us to understand?
No, I'm saying that the complexity of what has been going on with the economy because of the issues related to the financial services district and decisions that were made there with regard to deregulation and other concerns are much more overriding in terms of what's been going on in the economy
then let me go here to
Affordable Care Act.
the Federal Reserve recently had a report from all their districts. Employers in several districts citing the unknown effects of the Affordable Care Act as reasons for planned layoffs and reluctance to hire more staff. They seem to put a point on it.
I think that those were very isolated reports on anecdotal evidence, and we don't see any implications of the Affordable Care Act for significant changes in employment over time.
Yeah,
so anecdotal evidence can be frightening, and I appreciate that.
But
I
this is
also
the Federal
know that
Reserve. They're
employers
not
respond to market
Drudge Report. They are, the Federal Reserve. So presumably they would vet a little bit and try and put it in context.
At this point, I have not seen. I looked at that report. There was no data behind that. I do believe that they were conversations with particular employers, and I do understand that there is misinformation and anxiety that is being provoked in employers at this point prior to implementation of the full reforms. But as I noted earlier, employers are interested in making profit. They're interested in pursuing labor and hiring the right types of workers. In order to get the kinds of workers they want, they've got to compete with other employers, and so they have to provide them with the benefits and compensation. Just because we're out of time, we have to go back.
I will point out that also there's a CBO report that shows those who are most vulnerable are low-wage workers. Their elasticity of employment is the greatest. I grant you the CEO or the solar engineer is going to have a job. It's going to be the low-wage earner who's going to be most vulnerable, and that's per CBO. But I yield back. I'm out of time.
Chair, thanks, gentlemen, and now recognize the gentlelady from the Virgin Islands, Dr. Christensen. 5 minutes for questions.
Thank you, Mr. Chairman. Ms. Roth, your testimony, you make a number of assertions that really seem to run counter to the facts reported by independent sources like the Bureau of Labor Statistics as well as CBO. about the impact of the ACA on job creation. For example, the restaurant industry, which you claim and Mr. Boucher suggests would likely drop coverage and downsize their employees as a result of healthcare reform of the law, actually has added more than 800,000 jobs since the passage of the Affordable Care Act. And as we heard from Dr. Bloomberg, you know, you would expect some to be part-time, some to be full-time, but 800 new jobs. But my question relates to one particular threat that you posed to healthcare reform in your testimony that I found particularly interesting. You wrote that because of healthcare reform, businesses have an incentive to become more automated or machinery intensive, and your examples are that fast food restaurants might serve pre-cooked rather than freshly cooked food, or that DVD rental stores might close in favor of automated DVD rental machines, or the convenience stores might start allowing for self-checkout. These dangers that you cite as a part of Obamacare are particularly interesting because they've really been occurring for a very long time. Automation and increasing use of technology are enormous seismic shifts in our global economy. Is it really your contention that these trends would not be occurring if healthcare reform were repealed?
Thanks for that excellent question. My contention is that more employers will choose to substitute capital for labor as labor becomes more expensive. And of course, our economy has been continually getting more mechanized. What I was saying is that these trends would be faster. Also, with the 800,000 jobs added to the fast food and restaurant industry, there might have been even more of them added without the Health Care Act. But I think more importantly, the incentives to choose part-time workers over full-time workers will mean that actually there will be more employees in the restaurant and retail and other low-wage sectors, because employers will have an incentive to keep them to fewer than 30 hours a week. Because if it's fewer than 30, they won't have to pay a penalty. So it makes sense for companies to share.
Yeah, but my question was really about tying it to the increasing use of technology, which is happening at, you know, really fast speed, not only here but across the country. So, you know, there are a lot of wild predictions of the impacts of healthcare reform, but I think examples that were used in your testimony are really beyond explanation. We have a global economy in which every other advanced country has some form of universal health care, and they are experiencing the same dramatic technological advances that are happening every day. And to blame Obamacare because Netflix is popular and Blockbuster's closing just defies belief. So, you know, I think, you know, as other people have pointed out, some of the assertions that are made about job losses from Obamacare are really over the top. But I wanted to use the rest of my time for Dr. Bloomberg, if I might. Marcellus Owens.
Well, am I allowed to respond?
No, I need to use my time. He was 11 years old when he stood next to President Obama when he signed the Affordable Care Act into law. And his mother's poor health had cost her a job, her health insurance. She was a person with a pre-existing condition, and she eventually died. And that's an example of what happens every day in our country, especially to minorities and people living in rural communities. And it not only costs lives, maybe as many as 100,000 are what is reported, and it costs the country an excess of over $80 billion a year by some reports. So it's an example of just why healthcare reform is so important. Uncompensated care costs to providers such as hospitals and community health centers will soar if the numbers of uninsured rise. And more people will use emergency rooms. They'll become more overcrowded. Hospitals will be bearing more of unpaid care. Could you please just elaborate for us, Dr. Bloomberg, on how detrimental uninsurance is for individuals, families, and for our country overall?
Sure. The uninsured, the research evidence is very clear on this, that the uninsured receive less medical care and they receive less timely care and they have worse health outcomes. And in fact, the risk of death with a given medical condition controlling for health status appears to be about 25% higher for the uninsured than for those who are insured. We have seen from the experience with comprehensive health care reform similar to that of the Affordable Care Act in Massachusetts, that since its implementation, individuals have had greater access to care. They've had lower rates of not being able to afford care, and that has stayed consistently increasing even throughout the recession period. In addition, the lack of insurance, as you know, provides a very substantial financial burden on many families, and this also decreases their use of care and causes many bankruptcies.
Thank you. Thank you, Mr.
Thank you, and the chair recognizes the gentleman from Kentucky, Mr. Guthrie, for 5 minutes for questions this time.
Thank you, Mr. Chairman. Ms. Fritz-Scott-Roth, you were going to respond to Dr. Christensen. I was interested to hear what you had to say. If you'd just take a couple of seconds or half a minute to what you're going to respond back, I would like to.
Okay, well, thank you very much. Well, as the cost of labor gets higher, and we had the minimum wage start go up at from $15.15 an hour in 2007 and gradually rise. As the cost of labor steadily gets more expensive, employers have an incentive to substitute machines for labor. There's an MIT professor called Alberto Alessino who has written in great detail about that. I'd be happy to provide any of you with any of the papers. He compared Europe and the United States, showing how higher costs of labor in Europe resulted in more capital intensity there in the production process.
Well, thank you. And Mr. Boucher, somebody said earlier that you couldn't say with a straight face that that jobs have been either on hold or some way because of the president's health care bill. But I think your face was straight. And I'm not sure if I know what a straight face is or not when I look, but it looked that you did make a decision not to open a restaurant because of the uncertainty affiliated with the health. Is that true?
That is correct. And the key word being uncertainty. That was, and it still exists right now with regard to a fair amount of the rules that are not real clear right now. There's still a lot of uncertainty.
And that's what you hear. I mean, I hear that quite a bit. I know it's anecdotal, and I appreciate research and appreciate that. But on Friday, we were in our districts, and I was working, got a call to go see a gentleman. He just went to a business owner that just had gone to a seminar, or he's got his group together with their insurance agents. And I mean, the anxiety was not settled with him, and he was really concerned about decisions he's going to make in his business, the part-time work and so forth. So those are the real issues. I know we're talking about 6 million new jobs in the labor force, and we're grateful to have 6 million new jobs. But you look at labor force participation, you look at the underlying part of it, and even last month when the new jobs got, I think it was 170,000 new jobs or something, but they say we need to make 250,000 to keep up. So I don't think anybody, even though we're glad we're not going the other direction like we were, I don't think anybody's saying that we have a robust economy moving forward. And I don't think you can just point out one thing and say it's this healthcare bill, and I think it's a conglomeration of a lot of things that are going on to create uncertainty. But I certainly think, and I do know, and it's anecdotal, but it's everybody I see that's in business are just concerned about, even people who offer good plans, what's going to be in the essential benefits plan, what are the rules going to be, and how they're going to have to treat those. And so it's a real concern that the businesses have, and this just isn't us get together and try to point out different things. This is what we hear when we go home. I mean, I go, you hear concerns about when I didn't even think about it. But here I walked in, somebody says, well, if the rebate comes back from the health insurance company to my employee because of the medical loss ratio, do I get that? Does it come to me? Does it come to the employee? I paid 80% of the premium. Do I get that back? Well, we got to sort that out. Then the next question was, well, is it going to be chargeable to this year's wages or next year's wages? I have to go do another W-2. I mean, so there are just all these things that are out there that maybe in the future obviously will be settled, and people will get back. You know, if it's the law of the land, then we'll figure out how to make it work. But you can't say it's not affecting people's business decisions today, I don't think. And I can say that with a straight face because I hear it.
And if I may, you know, I'm considered someone who's knowledgeable on this topic. And I still don't know nearly what I need to know. And I have fellow restaurateurs calling me, asking me, so what are you going to do? And my answer to them is, I'm not sure yet. And they're relying on me to help them kind of walk through this. And truly, I'm not exactly sure what we're going to do yet.
Because another concern would be in the restaurant business, if you have 3 restaurants and each restaurant has 20 employees, then you got to decide, do I keep the 3rd restaurant? Or if you have 2 restaurants, you open the 3rd. Or if you have 3, do you close one? I mean, those are real concerns out there, and it's not, as some people have said, that we're sitting here just trying to do political points. My family's in business. We offer health insurance, and pretty good health insurance, actually. And we're in that mid-sized employer category. And I guess, Dr. Bloomberg, you talked about the change in compensation would be tiny. I think I wrote that as a quote. It doesn't really depend on the level of skill of your employee. That people were trying to, there's a book called Chutes and Ladders. It's interesting about getting people into, it was a fast food restaurant study. The ones who showed up for work, came to work every day, they studied them over a course of time, and they're all managers. I think that's how you said you started. Managers in restaurants. And so the question is, if you're low skilled, and those are people that I work with and deal with, how do you get them into the workforce if you make them too expensive to bring into the workforce? Do you think that'll have an effect?
I do take that into account. One of the things that's important to remember is that for very low-wage workers, the Medicaid expansion provides very comprehensive no-cost coverage to those individuals for the states that are choosing to participate. And those individuals, those workers, when they participate in Medicaid, they incur no penalties on the employers as a consequence. In addition, while the mid-sized employers are obviously a concern, we know that there's about twice as many workers in the small employer group than in the mid-sized employer group, and they are significantly more likely to have lower wage, those workers, and as a consequence of the small employers being consistently there, they will continue to be less likely to offer than their larger counterparts for a number of reasons. But the non-group market and its financial assistance for the modest income who are above Medicaid eligibility is going to be a huge boon for low-income workers in small firms as a consequence of the reform.
Gentleman, time's expired. Chair recognizes the gentleman from Maryland, Mr. Sarbanes, for 5 minutes for questions.
Thank you, Mr. Chairman. Before I turn to the panel, I just wanted to caution. I'd heard this discussion a moment ago about repealing the medical device tax, and I do want to point out that Congressman Ryan's budget plan includes the revenue from that tax in his proposal. So it's a little bit like that game, pick up sticks, where you throw them down, they're all tangled, you start pulling sticks out of the thing, the whole thing will collapse. And we need to make sure that that and other things related to the budget proposal are in the record. Now, Mr. Boucher, just real quick, you said in response to a question you made a decision not to open another restaurant. When was that decision made?
In the July of last year, as we were heading towards the elections.
Right. I want to follow up on something that Dr. Bloomberg said. I think it's a terrific point, and that is the ultimate fate of the ACA was in question, really, until this election was over. It was kind of a three-part drama. We had the passage of the bill, which was highly contested. Then we had a judicial challenge to it. The Supreme Court removed that piece of uncertainty. And then we had a referendum in effect on whether it should go into effect, and that was the election. And it's now the law of the land, as Speaker Boehner has indicated. There were a lot of people, and I would imagine you were among them, and many of your colleagues, who were sort of saying to themselves, until I know whether this is actually going to be the law and implemented, why am I going to spend a lot of time trying to figure it out? And so there was good reason why many people remained uninformed about the details of implementing this. Now I think you've got people that are very eager to know how it's going to be implemented. You indicated, Dr. Bloomberg, that as you talk to small business people, they're exhibiting a tremendous amount of relief in many instances when they understand what's in fact required, as against a lot of the misinformation that was put out, which gets further distorted in the midst of a highly charged political campaign, of course. We end up with sloganeering instead of real attention to what the regulations would require. So I think that's going to make a difference now as small business people and others, frankly, come to the table and try to understand better what we were trying to achieve. Now, a lot of what we were trying to achieve was to address the situation of small business people in this country who were dealing with stratospheric healthcare costs, having to make these tough decisions affecting their workforce. And much of what we designed was meant to address that anxiety, the specific anxiety of small businesses. And I say that because if we determine over time that there's certain things that we need to go in and tweak and fix and address to make sure that the concerns of small businesses are met. We're going to do that because that was largely the original motivation behind many of our investing so heavily and putting a lot of political capital behind the ACA. I remember a statistic that small businesses on average are paying somewhere between 18 and 22% more in premiums for the same exact benefit packages than large employers because they didn't have the benefit of pooling. I imagine that is going to be addressed, and you see that playing out in your models. Is that correct?
That's correct. It's both the lack of pooling that has been in place for small employers so that the health status of even one of their workers or dependents could have a very dramatic effect on their average premium, plus the fact that they were charged considerably higher administrative costs for purchasing coverage than were their larger counterparts, plus the fact that they tend to employ lower wage workers, and as a consequence, there's less flexibility in terms of adjusting wages versus benefits.
So we have good expectation that that can be addressed over time. The other thing is, I recall another statistic that the cost shifting that went on because you have people showing up in an emergency room, that cost had to be borne someplace, and it was getting borne by those who did have health insurance to the tune potentially in some instances of $1,000 per person in terms of increased premium. Now, I don't know if it was 1,000 in certain instances and not others, but there was an extra premium being put in there because of the cost shifting. Isn't that correct?
Depending upon the market power of the hospitals, yes, there is some potential for cost shifting there. A lot of those uncompensated care costs are paid for through state and local governments that will have some relief and should lead to lower taxes.
So I guess I'm going to run out of time here, but if there's an uptake of 75% of the 45% that currently have not uptake your offer, if 75% of them do, and I recognize it represents a cost for your business, but that's less people that are going to show up in an emergency room and result in cost shifting. That's a burden on your business and others. And the point is, over the long term, the trajectory where we were headed for small businesses and their costs was going like this. I think with ACA, it's going to still be going up for a while like this, but it's going to start going like this eventually. And we're going to get the benefit of this reform, and that's going to be a significant benefit for small businesses in this country. And I yield back.
Gentleman's time's expired. The chair now recognizes the gentlelady from North Carolina, Ms. Elmers, for 5 minutes for questions.
Ms. Roth, I have going back to the medical device tax, I have a question for you. You know, the administration and other supporters argue that there will be a, quote, windfall from the increase from newly insured patients as a result of ACA, and the tax will be offset. Based on your analysis, do you believe that there will be a windfall for medical device companies, or will the tax hurt device startups, capital investment, and job creation?
So I think that it will hurt medical device companies because quite a lot of their products are exported overseas, and they also have foreign plants, so they would probably shift the production of the exports into their foreign plants. And also, I don't really see as much of a decline in the uninsured as Dr. Bloomberg and others seem to think. Because with the Supreme Court decision, it was legal to pay a tax of $95 in 2014, about $350 in 2015, about $690 in 2016, and then you don't have to buy insurance. Well, CBO says the cost of a premium for a family of 4 is $20,000. For a single person, it's about $12,000. A lot of people are just going to pay the tax, which is legal according to the Supreme Court, and then go uninsured. They will then continue to get their care from community health centers or emergency rooms, and then when they get sick, then they can sign up for insurance. Because right now, if you're sick, you can't sign up for insurance. You have to be because of the pre-existing conditions.
Right.
Be insured already, but under the new law, anyone can sign up at any time.
At any
So
time.
it's completely rational to stay uninsured until you're sick.
Sure.
And then the pool of insured is going to get sicker and sicker, and the price is going to go up. Every time the price goes up, it'll be more worthwhile for someone to pay the tax instead of getting insured.
Versus the insurance.
Yeah.
Thank you so much for your testimony. Thank you to the entire panel. This is very helpful. Dr. Bloomberg, I do have some questions for you. You know, you had just mentioned that the study shows that, you know, putting patients on Medicaid, that is actually a much better situation. And I actually have a study that is completely the opposite. In 2010, University of Virginia released a landmark study on patients who have had surgery, and it is in stark contrast to what the testimony you just gave. And I would ask the chairman if we would be able to submit that study for the purposes of this subcommittee hearing.
Without objection, so ordered.
Great, thank you. And I won't get into the details of it, but basically it's startling to know that if you're on Medicaid, you actually have a 13% higher chance of dying than if you are uninsured, according to this study, and actually double the amount versus someone who is insured. So it's an interesting thing, and also the cost of health care actually increases because if you're on Medicaid, your health care stay in the hospital would actually be 42% longer than if you had insurance. So that being said, you had given your testimony about your study, and I'd like to submit mine. But I also, you know, to this point about anecdotal discussions that are being had by employers, you know, I have these discussions with my constituents every day, and they are so concerned about the cost of doing business and the ability to provide jobs in the future as a result of the Affordable Care Act. I have one particular constituent, Mr. Gerald Kivett, who, you know, he produces church furniture the old-fashioned way. And his business, it's been a family-owned business for over 55 years. 5 years ago, he had 150 to 200 employees. He is now down to 46 employees, and that is as a result of the economy. That obviously is not a result of Obamacare. But let's look at the facts. You know, the issue of, you know, adding employees. The economy is going to turn around at some point, and he is going to want to hire employees. How can he go beyond that 49th employee? And that's his question. If he were here today, he would ask you directly. You know, he's asked me, how can I, you know, afford this when my bottom line already is in the negative? So if Mr. Kivett were here today, how would you describe to him what you've been saying, which is that the Affordable Care Act is actually going to help small businesses?
I would like to respond to that. I'd also like to mention that it's not true that an individual can buy insurance coverage at any time regardless of their health status, because there are open enrollment periods in the Affordable Care Act, so people can only buy at certain times of the year. Otherwise, they will not be able to enroll. In addition, with regard to the Virginia study, there's been a great deal of experimental research done by with economists at Harvard University who have looked specifically at experimental data from the implementation of public coverage in Oregon, and shown that in a very short period of time there was actually very positive health status effects for those that were randomly enrolled in the expansion of public coverage there relative to those who are remaining uninsured. So I just want to say that the analysis that you're referring to, I haven't seen specifically, but it is inconsistent with all of the other economic research and health that I've seen on that topic.
We'll make sure that you get that study as well.
Great.
Thank you. And to, you know, again, if I were Mr. Kivett, what would you say as far as, you know, how is this going to help him to be able to provide health care continue to provide health care for his employees?
Well, right now it's going to save him a considerable amount of money potentially, and help his workers obtain health insurance coverage even if he doesn't offer coverage today. If he does offer, he's going to have new opportunities to offer coverage in the insurance exchange if he wants to. Otherwise, he can continue to offer coverage outside the exchange as he may or may not do today, depending upon his situation. If he doesn't offer and his workers would like to obtain coverage, don't get it through a spouse, they can then go into the non-group exchange. There's no penalty assessed on him. They can get financial support if they need it to buy coverage. So those are significant advantages.
The chair recognizes the gentleman from Florida, Mr. Bilirakis, 5 minutes for question.
Thank you, Mr. Chairman. Appreciate it very much. Mr. Roth, recently a major Florida employer announced that they were dropping health care coverage for part-time workers because the health care law effectively outlawed the low premium, limited coverage plans that were offered to their employees. I'm concerned that this law is making coverage more expensive for Florida and causing premiums to increase an average of 61%, according to actuarial studies. Could you elaborate on the provisions of the ACA that will raise the cost of coverage for small employers and other individuals in my state?
One element that's going to raise the cost of coverage is requiring a very large, generous plan rather than the plans that the employer you mentioned had before. So those are not going to be permitted. So that's one thing that raised the cost of coverage. Another thing that raised the cost of coverage is be able to sign up at, I shouldn't have said any time, at any open enrollment period, because that means you can go without insurance, you can pay the tax legally, and then you can sign up at the next open enrollment period, and in the meantime, go to hospital emergency rooms. A third thing is just the big new administrative costs of providing health insurance with the mandatory electronic records, all the new administrators, all the new IRS officials who are going to have to calculate what kind of penalties people are going to pay, also the subsidies, which reach up to 400% of the poverty line. When you go to an exchange, the amount you pay is going to depend on how much you earn. Again, this is a very big administrative burden. The tax credits for small business, those phase out. That's not for all small business. It phases out between 10 and 25 workers. So you get the most tax credit if you have 10 workers, declining to 25. You employ 26 workers, you don't get a tax credit. It also declines if your average wage is between $25,000 and $50,000. So it will steadily decline from 25 to 50,000. If you pay an average wage of 50,000, you don't get the tax credit even if you have over 10 workers. So all these different things increase the cost of health care. But I would say the number one is mandating a large, generous plan and completely disallowing the smaller plans where people shop around and so they pay more attention to their health expenditures.
Thank you. Mr. Boucher, do you feel HHS has been forthcoming with the guidance on how to implement the health care law, the provisions of the health care law? If not, has this made it very difficult, of course, for you and others in the industry to manage?
I think they have in some cases, but there's still a lot of uncertainty with regard to many of the rules. There's a laundry list of items that I'm still not clear on how it's going to affect our business or even our employees. And we're anxious to hear how it's going to be defined so that we can plan and strategize for our future. Because right now we're just waiting and trying to work. The association is trying to work and find solutions that work for both parties. But we need some answers that work.
Thank you. Again, last question for Mr. Boucher. Has navigating the ACA regulations forced you to incur any additional costs?
Well, as I stated earlier, I personally have spent, and my human resource person has spent upwards of 100 hours just filtering through all of this. And I anticipate it to continue, not at that pace because we're up to speed pretty good now, but there's still fair amount of work to do once these rules continue to come out. And then ongoing, the administrative efforts that we're going to need to track and enroll employees if the auto enrollment stays as it is at 90 days, which we're opposed to, that is going to be an extremely difficult process for us. And even right now, looking back to try and determine the look-back period, we're having to deal with two different sets of data because we switched payroll companies at the end of the year. So we're trying to meld one payroll company's data with this year's payroll company data. They don't really talk to each other that great, and neither one of them has a great system in place right now for helping us to track that looking forward. So I feel like we're behind schedule here, and I personally would appreciate some relief in some fashion so that we're not subject to some kind of penalty because either the payroll companies aren't up to speed or the rules haven't been defined yet, and that's really the crux of the uncertainty that we're facing.
Thank you, Mr. Chairman. I yield back.
Chair thanks the gentleman, and now recognize the gentleman from Virginia, Mr. Griffith, for 5 minutes for questions.
Thank you, Mr. Chairman. I've heard numerous people here today say that this probably shouldn't have a big impact on jobs. I've even heard some folks say they thought when they heard the title of the hearing was Health Care Act and Jobs, they thought it was going to be, something positive. I'm here to tell you that's just not the case. I'm proud to represent the Commonwealth of Virginia. Served in the General Assembly there for 17 years. Virginia, which would be closer to a big business than a smaller business, has made the decision. Both the House and the Senate, at the request of the governor, have limited part-time hours for state employees. Now, it still sits on the governor's desk and has not yet been signed into law, but since he requested it, I doubt he's going to amend it out. And so we are facing a situation where 7,000 workers in Virginia are going to find that their hours are being cut. A friend of a friend, it has been reported to me that a friend of a friend is now looking for new work. She had been working for the Department of Health, but with the cutback in the hours, she's got to find something else in order to take care of her family. These are the real impacts. This is the real impact on jobs, and it's just not the Commonwealth of Virginia alone, and I don't know about other states, but in my district, the town of Wytheville, now it's not a big town, and I'm sure it's not nearly the 7,000 people who are affected statewide, but the town of Wytheville is also considering cutting back on their part-time hours. And in an editorial, and I think they've said it very, very well, in an editorial that ran on the tricities.com site, which usually means it's either the Wythe paper or more likely the Bristol Herald Courier, they said that consider these cuts, in referencing the fact that the town of Wytheville and Councilman Hunley said it would be cost prohibitive to provide all the town's part-time employees with health insurance, so they're cutting their hours back. And then they referenced the Commonwealth of Virginia, and they said, consider that these cuts are coming from entities with no profit motive, no corporate board demanding right-sizing, no shareholders screaming for costs to be held down, and no customers who can take their business elsewhere. Then ask yourself what the average business, which does not face those extra demands, is going to do. Well, I will tell you that what I hear from numerous small and medium-sized businesses, what they're going to do is that they're also going to cut the hours of their part-time workers. And in some cases, and I'll ask you this, Mr. Boucher, I know you haven't done it, but if you are not hearing from lots of your colleagues that they are in fact shutting down stores in advance, knowing that if they have a store, now it's not all the PPACA or Obamacare, but as one of the restaurant chains in my area's CEO told me, he said, we're not going to shut all our stores down. It's going to make life harder. But in those stores that are marginal stores, we're going to shut down. And I don't know if that was the only factor, but I did notice about 6 months ago an announcement that one of his stores in an area that's probably a marginal area had in fact shut down. Are you already seeing in the industry, I know you didn't do it, but are you seeing in the industry that folks are eliminating those stores that may be in the black, but are just barely in the black, and the cost of this additional cost to them with their part-time employees will hurt, and therefore they're just going ahead and making the decision to shutter the doors?
You know, I can't speculate on what other restaurateurs are doing, but I will tell you that there are different business models for different levels of dining. You know, fine dining has different business model than fast food, than casual. And, you know, as I stated earlier to the gentleman, that, you know, our end of the day is 4 cents of every dollar. If there are restaurants that are 1 cent on every dollar, this puts this
so you can see under certain business
edge.
models, because I have limited time, but you can see under certain business models that this might very well affect those entry-level workers and the folks working in the restaurant industry. Am I correct? Yes.
There will be restaurants that are right on that tipping edge that could be pushed over.
And let me say this. In Virginia, the vast majority, although I referenced somebody at the Department of Health, the vast majority of these employees actually work in our 23 two-year community college systems. And one of those community colleges spokesmen was quoted as saying that one of the big detriments that they have from the state taking this action as a result of PPACA, that they are going to lose an asset. And I quote Josh Meyer, spokesman for Virginia Western Community College. One of the great advantages of community colleges like Virginia Western is that we can agilely adapt the training and educational needs of the region. Our adjunct faculty gives us the flexibility to create new courses as the need arises. This new policy will limit the hours that such faculty can teach. He wrote that in an email to the newspaper. And obviously, if you need to gear up for some new area and you don't have the personnel to do it, you're actually going to impact the ability to retrain folks who need jobs. Am I correct?
That is correct.
I thank you and yield back my time, Mr. Chairman.
Chair, thanks, gentlemen. That concludes our first round of questions. We'll go to one follow-up per side. And Chair recognizes Mr. Pallone for 5 minutes for follow-up.
Thank you, Mr. Chairman. As we hold this hearing today, I've mentioned that our colleagues on the Budget Committee are debating the House Republicans' latest budget. The Republican budget repeals the coverage provisions of the ACA and will leave 27 million additional Americans uninsured. It will roll back all of the consumer protections the law has put in place, allowing insurers to discriminate on the basis of pre-existing conditions, charge women more than men for the same insurance, etc., and it turns Medicaid into a block grant. So I just wanted to ask Dr. Bloomberg, much of the discussion today has been around the changes the ACA represents for our nation's businesses, but I wonder if you can help give us some perspective here. If the ACA were repealed and Medicaid faced the significant cuts that Chairman Ryan envisions, are the millions of Americans who lost health coverage likely to have affordable coverage options in the private market? And then secondly, what would the loss of benefits associated with these cuts do to the economic and physical well-being of these Americans?
There would be very dramatic negative effects of repeal and block granting Medicaid, not only on middle-income Americans who are looking forward to the relief that the Affordable Care Act could provide them, but most especially on low-income Americans who really don't have other options. A relatively small percentage of people even in poverty, adults in poverty today, are eligible for public insurance coverage. They don't have the financial wherewithal to be able to purchase coverage. In addition, to the financial implications for the low-income and modest-income population, repealing would also have very negative implications for those that have poor health status, who are highly disadvantaged in being able to obtain health insurance coverage today if they don't have access to an employer-based offer of coverage. So they would basically set us back to all of the problems that we've experienced in the past. The block granting is another issue because the way that block grant is designed is that to give a particular amount of money to each state to manage their Medicaid costs, but the federal dollars would not grow over time at the same rate at which medical expenses increase. So not only are you losing all of the potential cost containment implications of the Affordable Care Act, but you're also then putting state budgets at a serious disadvantage relative to where they are today in order to provide coverage for the low-income population that they do currently have eligible. And so over time, they'd either have to cut substantially back on the benefits, cut substantially back on eligibility for the benefits that they have been providing, and this can have very damaging or to spend a significant amount more money out of their own budgets in order to keep coverage where it is today, which is often not feasible at the state level. So there'd be a lot of negative ramifications both for individuals and for state government as a consequence of taking those steps. With regard to the implications for the economy in general of repeal, as we talked about, there's often at least small net employment gains as a consequence of investing more in healthcare, which is a locally produced and purchased good, and so those would be eradicated as well.
Now, I know the ACA includes an employer responsibility requirement that encourages employers with more than 50 employees to offer affordable coverage, and then if there's a penalty if an employer chooses not to offer coverage. However, 96% of small businesses in the U.S. have fewer than 50 employees and are therefore exempt from the requirement, and of the firms that will be subject to the requirement, more than 95% already provide health insurance. Just talk a little bit, there's not much time here, about some of the economic benefits of the ACA for small businesses.
Well, particularly for small businesses, they're hugely disadvantaged today by not being able to buy, as you referred earlier to, not being able to buy employer-based coverage for their workers at the same price as do their larger counterparts. This is because the administrative costs that carriers charge the smaller groups are much higher because they're selling small group by small group, and they're doing medical underwriting. They had been doing medical underwriting of those policies. We'll continue to do that until January 1st, 2014. All of those considerations increase administrative costs significantly for those small employers, which would be decreased substantially under the Affordable Care Act. So lowering the administrative costs would be a very significant change because that's a big burden on small employers today, and one of the reasons they are less likely to offer. In addition, they tend to employ a lot of low-wage workers compared to their larger firm counterparts, and that means that under the Affordable Care Act, those that don't offer their workers will be able to have access, guaranteed access to affordable coverage through the non-group exchanges, which they don't have today, and that makes it easier for them to hire workers in the small group market. In addition, right now, the small employers are disadvantaged because by their nature of being small, they have the average risk for them that they're bearing in terms of looking at a price for health insurance can be extremely variable.
Gentleman's time's expired. Chair recognizes the Vice Chairman of the subcommittee, Dr. Burgess, 5 minutes for a follow-up question.
Thank you, Mr. Chairman. I do appreciate the panel being here today. I know it's been a long morning. Just a couple of things I'd like to kind of close the loop on. Mr. Sarbanes mentioned the issue of cost shifting and why it was so important to get the Affordable Care Act done, because all this cost shifting that's going on by the free riders in the system, people show up in emergency rooms who don't have insurance. But in fact, if you really look at the cost shifting that's going on, it's happening in the federal programs. Right now we have real difficulty in the state of Texas because a lot of providers are not opening their doors to new Medicare or Medicaid patients. And why is that? Because the federal reimbursement is lower than what it is on the private side. What happens then is the private side, private insurance or self-pay patients, end up making up the difference. I got to tell you, one of the most frustrating mornings I've spent in the last 2 years was the second morning of oral arguments over at the Supreme Court. I was fortunate enough to be there and listening to the Solicitor General base his entire case on the fact that, well, you got people who are showing up in the emergency rooms without health care coverage, and this cost shifting is costing all of us a bundle. Wait a minute. The patient who is covered by Medicaid, and we're going to expand that by a bunch, I don't know how much, but 16, 20 million people with full implementation of the Affordable Care Act in a year's time. If they can't get a doctor's appointment, then they're not going to a clinic. What are they going to do? They're going to show up in the emergency room because that's what they've always done. And that cost shifting will still occur. Because the government's reimbursement for Medicare and Medicaid is less than the cost of delivering the care, the cost shifting continues, and if anything, we're doubling down on that. This is not to disparage the person who's covered under Medicaid, but to disparage the agency that's responsible for the oversight of this. And for heaven's sakes, this committee, the best we could do if we want to extend coverage to more Americans, we sit here in this committee, the best we can do is to expand a program that's 45 years old that was intended to be a safety net program back in 1965. You know, the ranking member was chairman at that time. I just submit that there were better ways, but we never bothered. We never bothered to even ask. So I had to get that off my chest when Mr. Sarbanes said it's cost shifting that's costing the program. Well, cost shifting may be costing the program. It's not the free rider. It's not the 27-year-old who'd rather buy a bass boat than an insurance policy. The problem is the expansion, the vast expansion of Medicaid is going to make this problem a great deal worse. Let me just ask you a question, Dr. Blumberg, and it's a relatively simple question. I think Ms. Furchtgott-Roth touched on the subject that some dependent coverage is going to go away as a consequence of the requirements under the Affordable Care Act. Is that a fact?
There should not be a decrease in dependent coverage. It is
okay, let me stop you right there. Ms. Furchtgott-Roth, you suggested that there would be. Will there be a decrease in dependent coverage under the Affordable Care Act?
Employers are required to offer an affordable policy, affordable for a single person. So say you have somebody who earns more, isn't eligible for Medicaid. Say someone who earns $30,000 a year or $40,000 a year who has a wife and 3 children. His employer offers him affordable single coverage. Under the law, he is required to take that affordable single coverage. Also under
Now, that's an important point. He's required, he or she is
That's right. He
required
cannot turn
to
it
take
down.
that coverage.
Right, exactly. And his wife and children then are not allowed to get subsidized coverage on the exchange because he's getting affordable single coverage from his employer.
I got to tell you.
They can buy coverage on the exchange, but it has to be at full price. They don't qualify for the subsidies for people making under 400% of the poverty line. This is a very serious problem, and it was dealt with in the discussions. Because originally employers were required to provide affordable coverage for families, not just for singles.
Well, look, here's the deal. The Fort Worth Star-Telegram in the middle of January, headline of 500,000 children to lose health care under the Affordable Care Act. I mean, that is a big deal. Can you imagine if a Republican president pushed through a law that kicked 500,000 children off their health insurance? I mean, we would be hearing screaming from the mountaintops if that had occurred under a Republican administration. I don't know why it barely rated a news story. Now, the good news for those uninsured children, I think the Internal Revenue Service under the Department of Treasury has promulgated rules where those children will not be fined for not having health insurance that they then lost because of the Affordable Care Act. Is that your understanding as well?
I just don't know the answer to that question. There was a headline about it, an editorial in the New York Times last August. The editorial was entitled, "A Glitch in the Healthcare System."
Mr. Chairman, there are a lot of glitches in the healthcare system, as we've heard this morning. I hope this committee continues its due diligence to not just to expose these problems, but we need to work on solutions. I mean, after all, we can argue about the political stuff, but Mr. Boucher has got to deal with it on a very real, personal basis. He's not a think tank. He's not a public employee like we are. He's out there grinding it out every day, trying to battle the forces and to make it all work and to provide for his employees. We shouldn't make the landscape harder for him. We should try to empower him. And thank you, Mr. Chairman. I'll yield back my
Chair,
time.
thanks, gentlemen. That concludes our questions for the panel. I'd like to thank the witnesses for their testimony, for their answers. I remind members that they have 10 business days to submit questions for the record, and I ask the witnesses to respond to the questions promptly. Members should submit their questions by the close of business on Wednesday, March 27th. Excellent testimony, excellent hearing. Thank you very much. Without objection, the subcommittee is adjourned.